Diabetes is a condition that affects millions of people around the world. But did you know there are two main types? Type 1 and Type 2. Diabetes may sound similar, but they are actually quite different. Let's break down the key differences and understand what each one really means. First, let's talk about diabetes in general. Diabetes is a disease where the body either doesn't produce enough insulin or can't use it effectively. Insulin is a hormone that helps regulate blood sugar, so without it, sugar builds up in the bloodstream. Type 1 diabetes, also known as juvenile diabetes, is usually diagnosed in children or young adults. In this form, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the pancreas can no longer produce insulin, and people with type 1 diabetes need to inject insulin every day to survive. While the exact cause of type 1 diabetes is unknown, it is thought to involve a combination of genetic and environmental factors. Though it's less common than type 2 diabetes, type 1 is a lifelong condition that requires constant management, including regular blood sugar checks and insulin administration. Type 2 diabetes is far more common and is usually diagnosed in adults, though it can develop at any age. In type 2 diabetes, the body still produces insulin, but it either doesn't produce enough or the cells become resistant to it. Over time, this leads to higher blood sugar levels. While genetics can play a role in type 2 diabetes, lifestyle factors like poor diet, lack of exercise, and being overweight are major contributors. So what's the main difference? Type 1 is an autoimmune condition where the body doesn't produce insulin at all, while type 2 involves insulin resistance, where the body doesn't use insulin properly. Type 1 is often diagnosed in childhood or adolescence, whereas type 2 typically develops in adulthood. People with type 1 need insulin for life, but type 2 can sometimes be managed with lifestyle changes, oral medications, or insulin in later stages. While type 1 diabetes cannot be prevented, there are things you can do to reduce your risk of developing type 2 diabetes. Maintaining a healthy weight, staying active, eating a balanced diet, and managing stress are all key factors in preventing or delaying type 2 diabetes. Whether you have type 1 or type 2 diabetes, it's important to manage your condition well. This means working with your healthcare team to monitor blood sugar levels, taking medication as prescribed, and making healthy lifestyle choices. Both type 1 and type 2 diabetes require careful management, but with the right care, people with either condition can live healthy, fulfilling lives. If you think you may be at risk or are experiencing symptoms, don't hesitate to reach out to your healthcare provider for guidance. Thanks for watching. Be sure to subscribe for more health tips.